Thank you for joining us today. My name is Lee Clark, patient educator with the Aplastic Anemia and MDS International Foundation, and I will be moderating the presentation today. As we get started, I'd like to recognize the generous support of Bristol Myers Squibb, Agios, Jazz Pharmaceuticals, Genentech, and Takeda Oncology, and the generous support of patients, families, and caregivers for supporting the webinar program today. Due to the high volume of teleconferences on the internet, it is possible you may lose your connection during the webinar. If you are unable to view the webinar, you can call in to hear the audio portion of the program using the call-in number in your reminder email. Today's program will be archived to our website within 2 to 3 business days. You will be notified by email when it is live and ready for viewing. Immediately following the presentation, there will be a question and answer session. Please feel free to submit your questions at any time during the presentation. To submit a question or a comment, open the Q&A window in the lower part of your screen. Type in your question in the small text box window, and when you're finished typing, just hit enter. We will do our best to get to all of the questions today. When asking questions, I do ask that you do 2 things to help us manage the incoming questions. First, submit your entire question all at the same time. Second, please do not share any private health information in your question. Our speaker cannot answer any specific questions related to your health care. Today's specialist is Christina Gowin. She is an assistant professor of medicine at the University of Arizona Cancer Center. She is board certified in medical oncology, internal medicine, and hematology. Her passion about integrative medicine, and she is committed to supporting patients throughout their journey. With that said, welcome and thank you for joining us today.
Thank you so much for having me. I have so much gratitude for the opportunity to talk about this important topic, and for all of the listeners tuning in today amidst all of the craziness in the world today to really be invested in your own wellness, to be tuning into a topic today really speaks a lot about your own self-advocacy. So kudos to you. So today we are talking about living well with MPN and MDS overlap syndrome. And again, really excited to be here. So our objectives today, we have a few objectives that we're going to try to tackle together, and really it's just to appreciate this emerging field of what is now called integrative oncology. And to discover what I like to say, the 4 pillars of health, and we'll talk more about that. To understand the contribution that lifestyle medicine truly can make to your cancer care journey, and to really expand your awareness of the complementary and supportive care strategies that are out there. And finally, to truly recognize the importance of spiritual care and, importantly, joy in your cancer care journey. So what is integrative oncology? And I think this is a term that is becoming more and more prevalent within our cancer centers, more accepted, and really integrated within most cancer centers at this time. The Society of Integrative Oncology decided to come together and really develop this evidence-based kind of description of what is integrative oncology. And so I'm going to share that with you. Integrative oncology is a patient-centered, evidence-informed, and I love that, evidence-informed, because we're still developing the evidence base for integrative oncology. So we're using the best that we have to develop informed decisions. Field of cancer care that utilizes mind-body practices, natural products, and or lifestyle modifications. And in my opinion, it really should say and lifestyle modifications. That's really essential. But it's from different traditions alongside, not instead of, but alongside conventional cancer treatments. Integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum. And I love this, to empower people to prevent cancer and to become active participants before, during, and beyond cancer care treatment. And so now we have this really good definition, and I think they did a great job with that. And why is it so important to be thinking about integrative oncology and to really be employing that in your model of care? The truth is, as a cancer patient, you likely have unmet symptom needs. Despite the best efforts of your oncologist, treating nausea, fatigue, etc., the truth is that cancer itself, chemotherapy treatments lead to symptoms. And so we can do better as far as meeting the needs of our patients with perhaps more integrative approaches. We know that patients want these approaches. There's a desire out there. And not only is there a desire out there, but patients are already utilizing these complementary modalities to complement their traditional cancer care. Depending on the data that you look at, it's up to 80% of cancer patients at this time are already utilizing complementary methods. Here's what's scary. Only 14% in some analyses are actually sharing these complementary methods with their primary treating physician. And so this really highlights how it really needs to be an integrative effort at this time. It's not, you're doing this thing on the side and you're kind of just covering up as you go visit your oncologist. It's something that needs to be disclosed, to be integrated, and to be sure that it's being approached in this really evidence-based and safe manner. Integrative oncology really has the potential to impact outcomes, to impact the side effects of cancer chemotherapy, and it's very important for secondary cancer prevention. It potentially can decrease the cost of care as well, with decreased resource utilization and decreased hospitalizations for symptom management. For the last two, we really need more studies, more data to support these, but we're hoping that these are being formed and this will be truly part of the evidence base in the future. So MDS MPN overlap, this is a rare disorder. And so we're not just talking about one or the other, these are together. And so, it's really hard to find evidence-based data for a rare disorder. So a lot of what we're talking about, and truly in all integrative oncology, is extrapolated from some of the larger studies done in coronary artery disease and breast cancer, prostate cancer, colon cancer. Some of these more common disorders really have had the most robust data for us to base our recommendations upon. And so a lot of what we're talking about may be in a different disease that we're again extrapolating to another type of malignancy. As many of you know, MDS MPN overlap is really a combination of the two, the dysplasia or the abnormal cells that's associated with MDS, as well as this hyperproliferative or overproduction of blood cells that often happens with the myeloproliferative neoplasms. And they coexist with or without prominent splenomegaly or that enlarged spleen. And again, it's rare, 3 per 100,000 individuals over the age of 60. So a lot of my focus and research has been in conjunction with Ruben Mesa, who really is the guru of this topic, this NPN symptom burden. And over the last 2 decades, what we've learned is that it's not just the blood counts that we're treating. It's really the symptoms that are associated with the disease. And this has now become a new endpoint of therapy. In our trials, we're not just looking at blood count reduction or splenomegaly reduction or decreasing the size of the spleen, but we're now looking at what is the starting symptoms as a patient and how is therapy changing that symptom burden over time. And so now again, this is this new endpoint of therapy. It's very personalized and patient-focused approach to care, which I love. Again, just looking at this graphic, you can see how heterogeneous, how diffuse the MPN symptom burden is. And the data for MPN is, again, very robust for this topic. For the overlap syndrome, less so. But again, we do know that as a patient, you are experiencing these symptoms. And so we're keeping this in mind. And you should, as a patient, be thinking about these different symptoms and communicating them to your primary treating hematologist as a potential endpoint for your therapy. And so if you're really feeling symptomatic and it's progressing in the wrong day, that may trigger us to be thinking about a new line of therapy. So inflammation, we know that inflammation is one of the primary physiologic drivers within myeloproliferative neoplasms, and that we're seeing these upregulation of these cytokines and the impacts on the atherosclerotic, or that plaque formation that we can see along the arteries. And oftentimes in MPNs, what we're really trying to do is manage the risk for thrombotic and hemorrhagic events. And so, it's so key to be thinking about that physiology that we're learning about, and how can we modulate it? How can we cool the fire of inflammation? And so starting to think about what is inflammation? Where does it come from? And so some of the moderators of inflammation are things that we cannot control, right? Our genetics, what we're born with. But many of them are. We can control our environment to some degree. We can certainly control our diet, our exercise patterns, our sleep patterns, and the quality of our sleep, and clearly our stress patterns. We cannot control what happens around us, but we can control our response to what's happening around us and to be modulating that stress. And so again, inflammation is really this key component, and really getting to the heart of how do we modulate that inflammation is key. In MDS, this was recently published as a systematic review looking at medical conditions and modifiable risk factors for MDS. And I found this really interesting, that those that were participating in vigorous physical activity, tea drinking, dietary isoflavones, and so some of these soy products, had a lower risk of MDS, while those that had a higher BMI and were smokers had a higher risk. And what I took away from this study was, again, the idea that we can modify our microenvironment, our tumor microenvironment, with some of our lifestyle choices. This was a study I did a couple of years back, asking over 800 myeloproliferative neoplasm patients what kind of integrative medicine modalities were they currently using. And this was a very international study. We had over 50 countries in participation, and these were the top 10 integrative modalities. And a lot of them are really just kind of lifestyle, right? And so aerobic activity, nutrition, massage, yoga, strength training, acupuncture, meditation, breathing, chiropractic, and support groups. So those were the 10 most commonly utilized. And then what we did was we asked them, what were their symptom burdens? And we compared that to those who were not participating in those activities. And we did an overall group, and we looked at what were the patterns overall. And then we split them up into kind of these myeloproliferative phenotypes, the ET, or essential thrombocytosis, and the PV, polycythemia vera phenotypes, versus the myelofibrosis phenotype. And interestingly, we did see different patterns. And so there was a lower symptom burden for those with the ET-PV phenotype participating in aerobic activity, massage, and strength training. And it was a more profound effect in the myelofibrosis group for breathing exercises and support groups. And so this is, a survey-based data. It's not perfect, but it certainly gives us food for thought as we start to plan and think about our integrative medicine clinical trials. So here are the 4 pillars of wellness as I see them. And it's the body, it's the mind, it's spirit, it's joy. All of these things work together in a multidisciplinary way to enhance your wellness. And so what I'd like to do together today is really to focus on each one of these pillars. And we'll go through them kind of systematically and how they individually contribute to your wellness. So on the body category, it's really the basis is conventional medicine, the best of our precision-based medicine, the best of NCC and guidelines, which is truly our gospel in oncology care. So we're pairing the best of what we have in Western allopathic medicine to all of these other things. Again, that is the definition of integrative oncology. So that's really the foundation, that's the key place to start. The next step up is really lifestyle medicine. So let's begin to kind of tackle what is involved in lifestyle medicine together. Again, the backbone of integrative health. And so we're getting back to this idea of inflammation. And on the right-hand side of the screen, what you'll see is this hallmark paper by Hanahan. And it goes through all of the different characteristics of what makes cancer cancer. And this was originally done in the early 2000s and then was updated in 2011 and included tumor-promoting inflammation. And I think this is key because if you see all the other kind of categories and we have drugs, everything is kind of like a drug target to pair with it. But with inflammation, yes, we have some general anti-inflammatory drugs, but there's no magic bullet for inflammation. And so again, dissecting out what contributes to inflammation. And that's on your left-hand side, tumor-promoting inflammation, chronic infections, obesity, smoking, alcohol, environmental pollutants, high-fat diets, all of these things and more, and was listed there, contribute to inflammation. And it's striking, again, to appreciate how many of them are truly modifiable. And so let's move on from there. But yeah, inflammation is so key. And so how do we, within the diet, start to think about cooling inflammation? And I love this picture because this is, in a lot of my integrative oncology consultations, I tell my patients to eat the rainbow. And by that, I always say, not the Skittles, people. It's the fruits and vegetables. And it's every one of these colors really has different phytonutrients that work synergistically together to decrease inflammation. And so I try to recommend to get something from each color in each meal, if possible. And I love this quote from Hippocrates, let food be thy medicine and medicine be thy food. And that is, again, my approach to a lot of patients is that medicine is food. You can't, take a handful of supplements and then go eat a Big Mac and think that everything's okay. That's not really the philosophy of integrative medicine. So what you fuel your body really can change the biochemistry of your bloodstream. And we see the most robust data for this from the Mediterranean diet and a lot of our cardiovascular colleagues who have really pushed this field forward. But we see that the Mediterranean diet is correlated with lower levels of some of these inflammatory markers, C-reactive protein, IL-6, tumor necrosis factor alpha. All of these are high inflammatory markers that can be cooled with diet. So this is one of the biggest studies done in cardiovascular research and diet, and this is the PREDIMED study, and over 7,000 patients participated, both men and women, and looking at the impact of Mediterranean diet on cardiovascular outcomes, and they did also measure CRP levels. And what did they see? You can see here on the left side, it's the incidence of cardiovascular disease. So that's major thrombotic cardiovascular thrombotic event or death. And those that were consuming more of these Mediterranean-based foods, these anti-inflammatory foods, had much lower incidence of the undesired outcome of cardiovascular events and death. And so you can see it really is kind of these beautiful curves of the green curve of those consuming the highest quartiles of this food had the lowest incidence. And then as the consumption of the foods went down, the incidence went up. So you may be wondering, okay, so that's cardiovascular disease, but what about cancer? Does it really correlate? And so JAMA Internal Medicine published this. It was in 2015, looking at the same study. This was coming from the Predimed trial, but they were looking at the incidence of breast cancer. And they saw a similar pattern, that with those that were consuming a very Mediterranean-based diet, particularly with extra virgin olive oil supplementation versus the middle curve is actually extra nuts. And so olive oil seems to have even more of a protective effect than the oils that are from tree nuts. But you can see this really beautiful separation of the curves in regards to incidence, a lower incidence of invasive breast cancer for those consuming a Mediterranean diet. So you'll get on the internet and you'll start Googling, and you'll Google, cancer and diet, and all of these things pop up. You have the Gerson diet and the Budwig diet and the alkaline diet, macrobiotic diet, and oh my gosh, you go crazy. And so I just give you a few kind of headlines about what each really consist of. And what I would say is that there's very little data to support any of these diets, with the exception of the ketogenic diet. The ketogenic diet is 70 to 80% fat, 15 to 20% protein, 5 to 10% carbohydrates. And there's something really unique about a ketogenic diet. We'll go through some of the biochemistry of this ketogenic diet. But if you look in clinicaltrials.gov, where is a wonderful resource to kind of get your hands on, what are the state of clinical trials going now, and if you put in cancer and ketogenic, you would see 35 ongoing clinical trials looking at ketogenic diet to either complement therapy or to decrease the risk of side effects associated with therapy. So cancer has a very unique metabolism, and it utilizes this Warburg effect. And so in our normal cells, we call that differentiated tissue, we have kind of two pathways. It goes to the oxygen pathway or the non-oxygen pathway, and the oxygen pathway produces kind of the energy of our cells, ATP, 36 ATP, and the non-oxygen is 2 of ATP. And so we try to use the oxygen pathway as much as possible because it's much more efficient. In contrast, cancer cells utilize, even in the presence of oxygen, this Warburg kind of pathway, where it's essentially utilizing glucose and pyruvate and only producing 4 ATP, which is again that energy kind of currency, the money of the cell, in contrast to 36. And so why would it be doing this? And so there's a few thoughts of why it's doing this. It's producing more of the byproducts of metabolism. So then the proliferative cell can use those byproducts again to build more tissue. It changes the local microenvironment, acid-base balance, several different theories, but the truth is we don't know exactly why cancer does this. But this is how cancer metabolizes, gets energy. And note that it is glucose dependent. It is stuck on sugar. In contrast, non-cancer cells would really, they love sugar, and particularly in the presence of oxygen, but also can use ketone bodies if unable to utilize glucose. Cancer does not have that same ability. So on a ketogenic diet, when you restrict the glucose, you're producing these ketone bodies in the blood, and the tumor no longer has its fuel source. And so it does get around it a few different ways, and it's not perfect, but it definitely is, it's limiting its preferred glucose fuel source. And so that's really kind of the thought process of what's going on with ketogenic diets. The ketogenic diet is not for everyone. It is certainly hard to follow for many. It can be associated with weight loss, and so those that are struggling already with weight loss, it often is not the best choice. I struggle a little bit with the ketogenic diet because there are ways to do it in which, you know, you're eating a quarter pounder with cheese and bacon and gobs of animal protein and cholesterol. And to me, that seems like it's promoting inflammation. And so that doesn't resonate with me. And so I think there are other ways to do ketogenic diets with more plant-based products, with nuts, with oils, that can be healthier in the long run for those that are interested. And so that's usually the conversation that I have with my patients. What about fasting in cancer? And so there's tons and tons of interest now in intermittent fasting, alternate day fasting. And this actually was recently even published in the New England Journal of Medicine on some ways to even think about how introducing intermittent fasting to your diet. It can alternate it can modulate inflammation, it can change your telomeres, it can affect hyperlipidemia and glucose metabolism. So there's really a lot of interesting physiology going on with intermittent fasting. Some papers are even talking about it decreasing the side effects associated with chemotherapy. But the truth is that we don't know enough about intermittent fasting and cancer care and how to do it safely. And so in general, I think the data is still maturing with this, but if patients are particularly interested and they're not cachectic, then I do have conversations about how they can potentially approach this. So what is the recommendation, right? After hearing all of that, what do we really recommend? And we don't have the data to support, so we're trying to get that data. And one of my colleagues, Robin Scherber, down at UT San Antonio, is working with UC Irvine to really develop this robust nutrient study, which is really looking at the impact of a Mediterranean-based diet. And so stay tuned for that. But in general, the Mediterranean-based diet is probably the safest way to go and has the most robust data to support it. What about physical activity? So physical activity is so important and often overlooked in cancer care. And again, we're stealing some of our evidence base from breast cancer, but this was from the Nurses' Health Study, in which there was an enormous amount of people that are enrolled back in the 70s, and we prospectively followed these patients over many decades. And in 2005, in JAMA, they did this analysis looking at physical activity and survival after a breast cancer diagnosis. There were 2,900 patients, and what they found is that the probability of mortality was lower for those that were participating in physical activity. And so you can appreciate that the lower curve is with more physical activity, and that's a lower probability of mortality. So the end point here is that physical activity was associated with survival, and a positive thing to be doing to prevent death from breast cancer. So there was a meta-analysis looking at physical activity mortality among breast cancer and colon cancer, and this was almost about 50,000 cancer survivors, and they looked at the impact of all these different kinds of exercise interventions on survival. And this is called a forest plot, and so everything to the left is a lower risk of the mortality. And this was cancer-specific mortality. And so in all the studies of breast cancer, colorectal cancer that they looked at in this meta-analysis revealed a lower risk relative risk of cancer-specific mortality with an exercise intervention. What about all-cause mortality, dying from all causes? And they saw very similar patterns, that those that were participating in physical activity had a lower risk of dying from anything, whether that be, infections, coronary artery disease, etc. So this is a particular area of my own passion, and that's meditative movement. And we did a study in combination with Mayo Clinic Arizona and ASU, looking at the impact of yoga in those afflicted with myeloproliferative neoplasms. And the average participation of approximately 40 patients was about 50 minutes per week, so not a large time investment. And we found that patients felt that it was helping with their coping skills. 75% felt that was helpful, and 68% really felt that it was satisfying to participate. But importantly, there was some changes in anxiety, depression, sleep, and fatigue, beneficial changes in those participating in even that low amount of meditative movement in the form of yoga. So we decided to take that another step forward, and we did a randomized controlled trial with a waitlist control. And here we wanted to see, were we impacting the inflammatory milieu, the inflammation in the bloodstream with yoga? And so we tested tumor necrosis factor alpha and IL-6 as well as cortisol. And we did find a significant decrease in tumor necrosis factor alpha from baseline with 12 weeks of participation. And again, an impact on their symptom burden as well. And so I think, again, meditative movement is a very powerful medicine. It's not only movement, but it's meditation. And we'll talk about more of the importance of that later in this talk, but a really wonderful way to get moving. So I showed you some data from breast cancer, and again, that was correlative data. It was not, a randomized controlled data. So it's not as strong of the data that we would like in physical activity. So we're, as researchers, really trying to push the envelope forward with that. What we're finding in some of the research for physical activity is that it seems to be disease dependent. And so whereas the magic kind of amount of minutes per week to truly be getting your best outcome can be different from breast cancer to colon cancer to a hematologic illness. And so that's why it's so important to truly start as researchers to really start developing these research protocols. So in general, the way I approach recommendations in the absence of that dedicated, MPN, MDS overlap exercise plan data is to really approach it rationally. And so get a mix of cardiovascular, of strength and flexibility training, and to listen to your body, let your body be your guide, but get moving every day and try to increase it over time to something that's tolerated for you, that feels good, and for a cardiovascular kind of target, 3 to 5 days per week, 20 to 30 minutes, and duration of moderate intensity is a reasonable goal. Trying to get strength, you need that cardiovascular exercise, but also you need to be building the muscle and keeping that muscle mass, particularly within chemotherapy. And so doing some weight training or some other kind of strength training is so important. Flexibility is also important. So just being sure that you're keeping that balanced within your exercise regime. So what about sleep? I think that sleep is really underemphasized in our cancer care, and that really should be part of our screen with every patient. And this was just a wonderful publication out of New England Journal of Medicine, again, just last year, highlighting that sleep can actually modulate the bone marrow's response and the kind of regulation, so to speak, of hematopoiesis, the formation of red blood cells, white blood cells, and platelets. And that it can impact the way our white blood cells form on the lining of our vascularity, which is atherosclerosis associated and inflammation associated. And so really paying attention to your sleep and trying to develop strategies to enhance the quality and depth of sleep is quite important. Strategies that I often recommend are very simple kind of sleep hygiene strategies, being sure that you have a daily routine where your body's starting to anticipate when to expect sleep, lowering lights a couple of hours before, keeping the room cool, having clocks and televisions outside of the room. If you're exercising, as you should be, trying to get that morning exercise in rather than later in the afternoon often helps. Trying to get bright sunlight first thing in the morning can be helpful, can help to kind of, it triggers something in the retina and the communication to the brain about our circadian rhythm. So trying to get 5 to 10 minutes of bright sunlight first thing in the morning can be also quite helpful. But again, sleep is so important, so try to really focus on that and maximize that. Okay, so we've chatted about the importance of conventional medicine, lifestyle medicine, and we'll move on now to complementary therapies. And I put that in the body category, but it also overlaps into mind, into spirit, and into joy. And so let's dive in there. Complementary care modalities, and my goodness, there is a list out there, and this is just really a sampling of what is out there. And what I would encourage you as patients and caregivers is to really explore what are the modalities that are out there in your community, and see what resonates with you. There is acupuncture, naturopathic care, herbal medicine, meditation, Ayurveda, hypnosis. I used to work at the first Native American Cancer Center, and we actually did native healing and prayer lodge for patients, and I found that to be transformational for some patients. Biofeedback, essential oils, homeopathy. I mean, the list really keeps going on and on. So again, just opening it up, trying to, again, be transparent with your hematology provider of what the modalities are that you are interested in, to be sure that you're pairing that with your therapy in the safest and most evidence-based way as possible, but also just starting to explore something new as far as the healing tool belt that potentially can complement your care. Acupuncture. So acupuncture is ancient, stemming from ancient Chinese medicine, and this is really becoming emerging in our medical literature as an evidence-based modality. And this was an NCI conference on the acupuncture for the symptom management in oncology. And they got together and they talked about the state of the science and evidence and what were the research gaps. And through that conference and the subsequent paper, what they found is that acupuncture is quite safe. The most common toxicities were from local needling, and it was the local pain, bruising, minor bleeding, and some issues with blood pressure as they're getting off the table. It should be noted that there are some specific areas of concern when receiving acupuncture with a hematologic malignancy, in particular, low white blood cells or neutropenia, or low platelets or thrombocytopenia. So it was recommended through that consortium, that meeting, that those that have a cancer diagnosis, and in particular, those that have neutropenia or thrombocytopenia truly should be receiving acupuncture from a seasoned oncology acupuncturist. And this is becoming more and more available within our cancer centers. They found that it was effective for many different ailments. Pain, fatigue, and nausea and vomiting were some of them. Anecdotally, from my own practice, I also see improvements in neuropathy, sleep, anxiety, etc. And so for those that are willing, I usually do recommend a short trial of acupuncture to see if it would be of benefit to them. So botanical medicine. This is an enormous field, and we could have an entire day symposium to talk about the role of botanical medicine, the safety and efficacy components associated with that. So I'm going to give you broad strokes today about botanical medicines, but we are not going to dive deeply on any particular botanicals. So what are some of the issues with botanical medicine? And when I say botanical medicine, that includes multiple vitamins, it includes any kind of supplement that you would get at the health food store. And the source and contamination, where does it come from? And the pill that you receive, the capsule, isn't what it truly says it is. There can be significant pharmacologic interaction, and so there are safe ways to look at this. And in my integrative oncology consultations, I get a list of these supplements that they're taking and their chemotherapy, and I do a rigorous deep dive to look at, is there any evidence for interactions? There are some really great resources out there for this. The Natural Medicines database is very helpful. The Memorial Sloan Kettering website has really wonderful interaction data. But the truth is that we do not have all the answers for interactions. And so it's so key to have an experienced provider to go through the supplement list and to really have this open conversation about risk tolerance in this category. We don't have safety data for a lot of botanicals, bioavailability data, meaning can you take the capsule and how much of it are you actually absorbing? And then there's just so much difficulty with the study of botanicals. Again, where is it coming from? If they're studying, let's say, lavender, are they grinding up the entire stalk? Or is it just the little buds? Is it coming from the Mediterranean, or is it coming from, Oakland? These are entirely different plants. And so there's so many nuances to the study of botanicals that we have to kind of hurdle before we can really get to some really quality data. And so just one more point on that is that I always stress food as medicine, because the truth is there's beauty in the synergy of plant medicine. And that by isolating a component, say for green tea, we can isolate one of the potent kind of phytonutrients within green tea, e.g. CG, but what are we losing with the rest of that tea plant? And there's all these other beautiful phytonutrients within the tea. And so my recommendation is to drink the tea rather than take the capsules. So food is medicine. So we're moving from the body category into the mind category. And mind is really about stress awareness and stress reduction. And what we know is that stress is a potent trigger for inflammation. And kind of coming full circle back to the beginning, that inflammation, again, is one of these drivers of our disease. And so if we can trigger the calming anti-stress response, it really is good medicine. And this was a review paper in Nature back in 2006. And I still hang on to this review, even though it's starting to become a little outdated, because I think it was just a really beautiful description of what can happen with chronic stress. And so this was looking at cell models, animal models, and human models, all of the data that we have, and combined it, saying with a stimulus, with a stress stimulus, which leads to the production of noradrenaline, adrenaline, and cortisol, what is happening to this tumor microenvironment? And so the data from all that, that at that time in 2006 revealed that the immune system, the immune response was hampered. Cancer cells were upregulating, meaning increasing their activity of proteases, so they're metastasizing more, they're migrating more, they're invading more. If there are viruses present, there's more viral replication. Interestingly, the blood vessel growth was enhanced in stressed animals, and we target this in a lot of cancer types. It's via VEGF. And there's actually an antibody out there that binds to that in cancer care. So this is a really potent potential mechanism of how stress is contributing to the cancer cell growth and contributing to the pro-cancer microenvironment. So I recommend doing a stress inventory. So however many times you can do this throughout the day, whether you have a smartphone and can set a timer, do it in the morning, at lunchtime, in the evening, but really check in and see, where is your stress? Are you in the left-hand column, the stress category within the mind? Are you worrying about the future, kind of ruminating about the past, doing this perpetual planning, this negative self-talk? And is your body, is it tense? Are you having these shallow breaths and cold, clammy hands? And all of that would be, more in line with the stress response and more norepinephrine and cortisol floating in your bloodstream. In contrast, on the relaxed side, you're in the present, you're engaging with breath, you're engaging and nurturing self-talk, relaxing the muscles and engaging in this slow, deep belly breath with warm hands. And so taking the stress inventory multiple times throughout the day gives us the opportunity to change and to shift more into that relaxation response. And so there are many different strategies out there. Breathing techniques are particularly powerful. I like to teach the 4-7-8 breathing technique, which is basically deep breathing in for a count of 4, holding that for a count of 7, and breathing out fully and intentionally for a count of 8. And you do that for 4 cycles. But in truth, there are many different breathing techniques out there. Breathing techniques are more powerful when practiced. And so I recommend for my patients to do it in the morning, in the evening, and any time that they're in a stressful situation, driving, perhaps receiving a blood transfusion or chemotherapy. These are times when it can be particularly powerful to engage in this deep breathing techniques. Other methods of meditation, mindfulness, aromatherapy, the list goes on and on. So the key is to recognize it, and then to have a strategy that resonates and works for you and that you practice often to release that stress when it's identified. Moving on to the spirit category. And spirit is such a unique thing to each and every one of us. We all have different religions, different spiritual values, and some of us have no strong spiritual grounding, and maybe it's just nature. But the idea within this spiritual category has nothing to do with religion, and it's more about finding connection and finding meaning. And so this actually comes from our NCCN guidelines. And I'll read this to you. Spirituality is the relationship people have with a force or power beyond themselves that helps them feel connected and enrich their lives. And through several different studies, we've found that those that have engagement on this level have decreased feelings of anxiety, of depression, of anger, decreased loneliness, decreased alcohol and drug abuse, lowered blood pressure, and better control of pain, nausea, and other discomfort. And so in my patient consults, we do some kind of soul searching for them and try to find what is it that resonates in this category. And is it, is it prayer? Is it mindfulness and nature? What is it? And then to develop a plan together to enrich this daily, whether it's 10 minutes a day, or 5 minutes a day, just something to start engaging this sense of connection on a daily basis can be incredibly powerful. And the final category is joy. And joy is about promoting happiness and gratitude. And I'll say, after doing several years of integrative oncology now, this category has been the most surprising. So many patients have lost their joy amidst being a cancer patient. That's consumed who they are, and they've lost the piece of themselves that made them feel alive in the diagnosis. And so this is a slow process for many of rediscovering what joy can be and redefining it. And I'm going to read two different quotes. One is from one of my favorite authors, Rachel Naomi Remen, from Kitchen Table Wisdom, and she says, "Joy is far less vulnerable than happiness. Joy seems to be part of the unconditional wish to live, not holding it back because our life may not meet our preferences and expectations. Joy seems to be a function of the willingness to accept the whole and to show up to meet whatever is there." And the other is, "I have to let go of my preferences and I'm living with an intense awareness of the miracle of the moment." And so I give my patients two different exercises to enhance joy. And we spend a fair amount of time on this topic, again, just exploring and defining what joy can be. But once we find a few items that spark joy and that can be attainable in the present, I recommend a daily joyful intention, something where they name and say, okay, today, this cup of coffee on my patio will be my moment of joy. And then they sit and they enjoy and really savor in every single experience of that cup of coffee, the smell, the taste, the warmth in the hands, etc. And then when they're done, just reflecting back and having gratitude for that moment. And that's just a simple example. And clearly there are other more meaningful ones, being with family, pets, being with nature, etc. But having a daily joyful intention and gratitude can be quite powerful. The other exercise I recommend is greeting the day with gratitude. Before even waking, or not waking up because you're awake, but before even getting out of bed, thinking about what is it that speaks to your heart and makes you feel just so grateful to be alive today. And trying to name at least 3 different things and then getting out of bed and seeing how that can shift your day just from that very simple 30-second practice. So our take-home points today are really rational, reasonable points, is to eat intentionally, to eat beautiful food and to enjoy it, to eat the rainbow, to move often and to listen to your body and to recognize that movement is in fact medicine for you, to breathe and manage stress and to do this in an intentional and thoughtful manner, to sleep well. And if you're not, to recognize that this is important and try to work on modalities to enhance your sleep to the best of your ability. To cultivate joy. Joy is medicine, joy is healing, and joy is why we're here for experiencing life. And so it can be just a phenomenally healing medicine to experience more joy and to finally to be open to new and innovative modalities of healing to change your definition of what medicine is. So I want to, before I close, I wanted really to say thank you to the organizers, to the Aplastic Anemia and MDS International Foundation for promoting and supporting this important topic, that integrative medicine really is just good medicine. Thank you so much.
Thank you so much. We have a couple of questions. First would be, do you have some tips for when patients may be looking at purchasing supplements or things? Reading labels can be really difficult. Are there some tips that folks should be looking at, or are there things that if they were to read on a label, maybe some things that they would want to avoid?
Really great question. Yes, there are quality assurance stamps that you should be looking at the back of your supplements. USP, NSF, and GMP are good quality supplement quality assurance labels. What you need to look out for is there's also fake labels out there. So if you just see a stamp on the back of your supplement that says, oh, that looks reputable, don't trust it. Really look for those three. I'll repeat those: GMP, NSF, and USP.
I'm sorry, Dr. Gowin. I think we've lost you.
Sorry.
We got you back. Okay, great.
There we go. Sorry, I was on mute. My apologies. For caregivers, when attending appointments with patients, are there some helpful things that they can be doing during the appointments to help out with making sure they're getting the information, and what can they be doing to help out with their patients and looking at integrative therapies?
Great. Yeah, so attending as a caregiver, all the appointments is so helpful. Just to have another set of ears to kind of hear what the plan is and the rationale can be incredibly helpful. Definitely having a notebook with you to take notes. Coming in prepared with your list of questions can be helpful. It's easy to get flustered during an office visit and get sidetracked and then leave and not have all of your questions answered. So really important maybe to have that all jotted down. In regards to more NPN, MDS specific things, I like to have my patients fill out the NPN symptom assessment form and bring that in with them during their visits. And so you can be proactive with that and already have that, so your provider can be looking at that over time and seeing if the symptom burden is changing. Also with transfusions, and so if you are transfusion dependent, you can get iron overload. So tracking the amount of transfusions can be incredibly important, and triggering, the provider, if you're getting in the realm of 10 to 15 transfusions in your lifetime, that's a time to kind of be thinking about iron overload. And then just, again, jotting down, being the scribe of the visit. And in regards to integrative oncology, it's, I think, overwhelming as a patient to take on all of those different pillars. So just reinforcing, the importance of that multidisciplinary care, that and the engagement in it. So if patients are not wanting to engage in the diet, then, listening to what they do want to do, and listening to the patient as far as, what to them resonates as a multidisciplinary healing, and what are aspects that you can work together as a team. But helpful things can be, prepping foods like smoothie preparations, freeze those in the freezer. They're easy to grab. Some soups prep can be helpful for the same rationale. Encouraging joy, encouraging exercise, and stress reduction. All of that can be largely directed and encouraged by the caregiver.
Thank you. Do you know if it is possible to have acupuncture despite having very thin skin, no subcutaneous fat?
Yeah, I would say that that is why it's so key to really see an oncology specific acupuncturist, at least initially. But yes, I have many patients that are in their 80s and 90s on chemotherapy doing phenomenal with acupuncture.
Thank you. Are you familiar with health and wellness coaches? And if so, have you found them to be helpful in supporting patients?
You bet. Yeah, I do think that that can be helpful, particularly if this health and wellness is a new domain and is a new interest. Having somebody to kind of, talk about the challenges and work together as a team can be really key. The University of Arizona has some dedicated health and wellness coaches through the Center of Integrative Medicine, so that could be a good resource if you're interested.
Great. Well, thank you so much, Dr. Gowin, for taking the time to spend with us today and sharing your expertise. If you would like to watch this webinar again at a later time, it will be available on our website within 2 to 3 business days. If we were not able to answer your question today, please send it to us at any time in 3 ways. Send an email to help@aamds.org. Call our helpline at 800-747-2820, extension 2, or submit your question on our Facebook page. On behalf of the Aplastic Anemia and MDS International Foundation, thank you for joining us today, making us your resource of choice for information on bone marrow failure diseases. The Aplastic Anemia and MDS International Foundation Medical Advisory Board and team are here to support you and your family as we have done for the past 36 years. This concludes today's program. Thank you.